So the first chapter we're going through tonight is chapter 24. It's the infectious diseases and sepsis chapter. We'll start off by talking about some various infectious diseases, sepsis, and then following it up with selected common communicable diseases as well. What I try to do in this particular lecture is make some highlights for you, because it does go through quite a lot of different communicable diseases. So with each one, if there's something super important to remember about them, I'll highlight it. But yeah, just to try and make it a little bit easier when you're studying. So infectious diseases, how are they spread? Well, bacteria, viruses, and other microbes, kind of the general how they're spread. Communicable diseases are spread through direct contact or contact with secretions. When an infection does cause an illness, the time from the exposure to the development of the first symptom is what we call the incubation period. So say somebody is sick, they cough on their hands, and then they touch a doorknob, they open the door, they spread all of their diseases over the doorknob, or their illness over the doorknob, and then, they go about their day. Well, somebody walks in right behind them, uses the doorknob, walks through the door, and then they go about their day. But the second person that touched that doorknob 3 days later gets sick. Well, that 3 days later is the incubation period. Okay. The interval when the patient is shedding or releasing infectious material is the communicable period, when the microbe can be potentially transmitted. So each disease process has a different communicable period and a different incubation period. The longer the incubation period is, the harder it is to control that disease, as well as problems with the communicable period as well. So a lot of times communicable periods are before patients start having a lot of symptoms, or sometimes they'll last longer than the symptoms as well. So the patients think that they're perfectly fine walking around and spreading all of these diseases. Factors causing infection and illness after exposure, so virulence, dose, route, and body's resistance. So all of us have a built-up immune system through, natural immunity that we've gotten from, our mothers, and then we've got immunity that we've built up just over time, getting, sick or small exposures, getting, slight coughs, where we're just building up a good immunity to them. So we all have that body resistance, right? As well as, any vaccines that you've gotten too. The route, so that would be, did somebody sneeze on you? Did you pick up the illness from like a doorknob, or, any other method, I guess? How much did you come into contact with? Was this something that you were, around somebody that was sick for the last 3 days? Well, that's a lot of potential spread that's happened. Or was it, literally just you touched a doorknob that had something on it, right? And then virulence is how strong it is as well. So if you come into contact it, what's the likelihood that you're going to get sick? Sepsis. So the pathophysiology behind sepsis. Sepsis is something you should be fairly aware of anyways, if not familiar with. You should be aware of it just because you all have taken your EMT1 class, right? And we would have covered this over EMT1. But sepsis is a life-threatening condition that results from the abnormal and counterproductive response by the body that causes damages to tissues and organs. The body overreacts, secretes substances that, instead of helping, hurt cells, tissues, and organs. That was a lot of words, right? What does it mean? Well, sepsis is essentially when your body overreacts to an infection. So say somebody gets sick, they get an infection, like a UTI is a common one. They get a UTI or a urinary tract infection that's a local infection to that area. Well, if it's not taken care of, or their body has an overreaction to that infection, eventually they would develop sepsis, which is a systemic response or an entire body response, immune response to what's happening. Sepsis is bad enough, but when sepsis turns into septic shock, which is essentially all of the signs and symptoms of sepsis, including blood pressure changes like hypotension, that's when we start really having some problems. So a lot of people die from sepsis. It's really difficult for us to manage pre-hospitally as well. So I like this next slide. It does, I think, a good job of kind of explaining how the process works. Typically, it all starts with an infection. it doesn't really matter where the infection is or what the infection is. Oftentimes that infection is usually from like a UTI or a urinary catheter or a port or anything that's permanently placed or temporarily placed into the skin, usually for medical reasons. But again, it's not always that, right? It could be just any infection, but it's a local response to what's happening. Once it becomes a systemic response, so the whole body is having a response to it, that's when it's a sepsis. And then septic shock is the systemic response with hypotension. So I just kind of mentioned all of that, right? It can be caused by any infection, but these are the common ones. So SIRS criteria. So this is more of a hospital-focused criteria. It doesn't mean that you won't come across it in EMS, but it's definitely not as common. There are some hospitals, I want to say Gunderson out of La Crosse has this. I would assume some of the Madison area hospitals would have this as well, but it's some sort of septic alert system. Usually if there's a septic alert in place or a sepsis alert in place, there's some sort of criteria, whether it's SIRS or whatever, that's in place that says, hey, if you meet or if you have a patient that meets XYZ criteria, it will flag us or flag the system as a sepsis alert so that the hospital can get the appropriate resources available to deal with that particular patient. So things like temperature is taken into consideration, heart rate, respiratory rate, systolic blood pressure, and new onset altered mental status. All kind of comes into play and factors into the decision as to whether or not this is going to meet this SIRS criteria or a septic alert. QSOFA is another one. This is also very similar. This one, it will also predict the likelihood of the patient staying in the ICU as well. We don't use these two criterias by name often in EMS. Like I said, this is a lot of the times it's hospital focused or pushed out by the hospitals for us to use, but I haven't heard of us using these in this area. When we're doing our patient care, we're going through our generalized assessment. Things to look out for would be, high temperature, altered mental status, essentially everything I just mentioned. But we're just going to be kind of on the lookout for it, anything that flags that, hey, they've got an infection and that this is potentially getting worse and not being taken care of. Our care that we're going to give at the EMT basic level is essentially just supportive, oxygen if necessary, and transport them to the hospital. Now, if you do have access to ALS level services, we're going to call them and see if they can start IVs. Patients that have sepsis really, really need to have a lot of fluids given to them. So selected common communicable diseases. So prevention is huge, getting the appropriate vaccines, using appropriate standard precautions. When we're looking at assessments of our patients, asking additional questions like, have you traveled recently? When you traveled, did you get the recommended vaccinations? Have you been in contact with anybody that's been sick? Are you yourself vaccinated? And not just, recent travel vaccines, but in general, have you gotten the recommended vaccines? All of those can tell us and give us different clues as to whether or not they might have picked up something, as well as, the signs and symptoms. We certainly should be wearing our own personal protective equipment to ensure that we are safe when we're taking care of these patients, or any patient, really. If it's a situation where we need to get further tested, that's something that workman's comp typically covers, and you'll get a phone call usually by the state that says, hey, you came into contact with a patient that has measles. We recommend that you go and get XYZ vaccine as well as get some blood drawn or an exam by your local physician, and then that would be covered by workman's comp. I will say I had heard about this happening, but it wasn't until I was working in Sparta, Wisconsin, when Fort McCoy had, I think it was 10,000 Afghan refugees come through the Fort McCoy base. So Sparta, Wisconsin went from having a population of like 10,000 to a population of like 20,000 in a very short amount of time. And a lot of the people that were the refugees that were coming through were sick. So we were dealing with a lot of patients, a lot of volume of things that we had never seen before. So there were a lot of providers getting phone calls from the state saying, hey, you came into contact with this, you need to go get tested. So it does happen even in our smaller communities where we might not expect something like that. Chickenpox. So this is called the Varicella zoster virus. Common signs and symptoms start with vague symptoms kind of resembling a cold, followed by a fever and rash that itches and looks like blisters. It's very contagious. It's direct person-to-person contact, airborne from rash on skin or mucous membranes. Dried scabs do not spread the disease. Kind of got a picture here of what that rash might look like. I think different stages of healing with those rashes kind of looks just a little bit different. Treatment and prevention, there is a vaccine for this now, kind of a readily available vaccine. Usually it's recommended for almost all kids, I believe. Treatment for this, not much we're going to do for these particular patients. Do our best to keep them as comfortable as possible on the way to the hospital. Make sure that the patient, as well as yourselves, are wearing masks, but that's about all we can do for these particular patients. Measles. So this is also called rubella. It's highly infectious viral disease. Common signs and symptoms. It usually starts with a fever, cough, and some eye irritation. Moves on to what we call Koplik spots. These are white, small spots on the inside of the cheek. And then there's also kind of a red blotchy rash that goes with it as well, which this is the next picture. So this is a classic measles rash. This is spread through inhaled droplets in the air, contact with nose or throat secretions as well. There's not really any specific treatment for this particular disease, but again, we're just going to do our best to keep our patients as comfortable as possible, oxygen if we need to. But that's about it, right? Prevention, there is a vaccination for this as well. Quarantine the patients, and then proper hand hygiene, as well as, wear a mask if they're coughing or anything. Okay, not much we're going to do. Mumps. So mumps is caused by the pareillomoxil virus. Signs and symptoms start with kind of vague, not feeling well, loss of appetite, muscle aches, headache as well. Progresses to swelling and inflammation of one or both of the parotids. Parotitis lasts about 7 to 10 days. So you'll see the picture here. So you can see how this little boy's face is nice and swollen on both sides. This is transmitted through droplets and direct contact with saliva. Prevention, there is a vaccine for this. And we're going to quarantine patients for about 5 days after that swelling appears. If we have a patient that has this, again, there's not a whole lot we can do. Do our best to keep them comfortable and transport to the hospital. Hepatitis A. So hepatitis is a general term that means inflammation of the liver. Then we've got different strains. Hepatitis A, B, C. I think it's just the 3 letters. Signs and symptoms: fever, nausea, loss of appetite, just kind of a generalized weakness, abdominal pain, jaundice as well, and then generally worse in older patients as well. Anytime we've got liver involvement, there's the potential of being jaundice, that yellowing of the skin. So you can see this face here, you've got quite a lot of yellow pigmentation, and then those eyes look a bit neon as well. That's all caused from liver. So hepatitis A is spread through the fecal-oral route. There's not a specific treatment of this. We can prevent it through proper food preparation, good hand hygiene, and there is a vaccination for this as well. Hepatitis B, or HBV, is very common in many parts of the world. Signs and symptoms: nausea, vomiting, loss of appetite, vague abdominal pain. It does have jaundice. Again, we've got hepatitis, liver involvement, so there's probably going to be some jaundice at some point. Younger patients have fewer or no symptoms, but much more likely to develop some chronic infections with this. It's transmitted through blood and any fluid that contains blood, so things like semen, cerebral spinal fluid, amniotic fluid, vaginal secretions, and there's a couple of others. There's not really a specific treatment for this. However, there is a vaccination. It's actually one of the first vaccinations recommended after birth. Proper decontamination of equipment after the call is really important as well. So anytime we've got blood, we need to make sure that we're cleaning appropriately after those calls. You'd be surprised how little tiny droplets of blood can get in all the little cracks and crevices of your cot and ambulance. So make sure you're doing a very good job of cleaning up everything. Post-exposure actions, so we're going to wash any exposure site with soap and water, see a healthcare provider right away, get updated on your vaccinations. Hepatitis B, don't quote me, but it is a step vaccine, so you get one initially, and then I think there's 3 or 4 after that that you get as well. So you would just make sure that everything's up to date as far as that's concerned. Hepatitis C is very similar to Hep B in many ways. Signs and symptoms are going to be almost identical: nausea, vomiting, loss of appetite, etc. This one is transmitted through shared needles, less commonly through sexual intercourse or childbirth, versus Hep B, which is fairly common during sexual intercourse and childbirth. Several safe medication regimens, but there's no specific vaccination for hepatitis C. Precautions. We're going to take our standard precautions and proper use of disposal of sharps, making sure that those sharps are going into the sharps container and not going just on the floor. Moving on to AIDS or HIV, signs and symptoms. For some patients, this is like a flu-like symptom within a few weeks of the HIV infection: fever, sore throat, fatigue, just generalized not feeling well. Quite honestly, we probably will never be able to diagnose or get a differential diagnosis of HIV. It's just too vague, right? AIDS, however, is characterized by opportunistic infections, things like Kaposi's sarcoma and tuberculosis. So this rash is fairly characteristic of having an AIDS infection. So in that instance, we might be able to kind of point in the right direction. But at this point, the patient would probably know that they're HIV positive or even AIDS, positive with AIDS. So this happens through shared needles, unprotected sex between men, any penetrative activity involving blood and semen during delivery or breastfeeding from mother to newborn as well. Okay. Antiviral medications are used to then reduce and suppress HIV viral loads. Standard precautions is what we're going to take, public measures as well, any sort of additional education that we can give about, shared needle use and promoting uses of condoms. Following significant exposure to blood or other bodily fluids, we're going to wash the area and consult a medical professional. You will probably, if you do get an exposure, you'll probably get some blood drawn just to ensure that viral loads are low. If it's a high risk, like for a fact your patient was HIV positive, and you got a needle stick from that patient, they will probably put you on an antiviral medication to start, just to make sure everything is good, and you're started on the meds as soon as possible. And then taken off of them if you don't have it. Influenza. So this is pretty common. I'm sure all of us have experienced a little bit with influenza, whether it was us personally or somebody that we knew. Signs and symptoms: fever, just generalized not feeling well, cough, muscle ache, sore throat, etc. It's spread by droplets or direct contact. Antiviral medications lessen the severity and shorten the time frame, but it must be taken within 24 hours of symptom onset. Good prevention would be hand hygiene, surgical masks, and there's a vaccination. This one, because we do come into contact with it quite a lot in EMS, it is recommended that we get it as a healthcare provider, the vaccination, that is, yearly. Croup. Okay, so this is one of the first ones that we actually need to really highlight here. So croup has a very characteristic seal bark cough associated with it. So anytime you see seal bark cough, whether it's a question on the National Registry or on the exam or on like quizzes, we should be thinking croup. Okay. Signs and symptoms, excuse me, inflammation, swelling of the larynx, trachea, bronchi. Typically, this is going to be in younger kids that are getting this, although it's not like adults can't get it. It's just more common in kids. 6 months to 3 years of age. Symptoms often get worse at night. It's transmitted through droplets from coughs and sneezes, or that survive on any objects. We're going to assess the child for any shortness of breath, give oxygen as necessary, and transport. Prevention, good hand hygiene, refraining from touching mouth, eyes, and nose. Pertussis, otherwise known as whooping cough. This is another one we're going to highlight. So anytime you hear or see a whooping, so hear the whooping sound, you're going to think pertussis or whooping cough. Or anytime you see it written on an exam or a test that, hey, your patient has a whooping-like cough or a whooping sound, what is that? Well, it's pertussis or whooping cough. Okay. This is spread through large droplets in the air. Treatment is with antibiotics and prevention with vaccination, good hand hygiene, and again, refrain from touching the face. Usually this kind of starts like an upper respiratory infection, and then the cough is kind of what really gives it away. And the cough, usually it's on the inspiration after a coughing fit. So it's like cough, 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 and that is the whooping sound that you're hearing. This is something that would be really good. There are quite a few different YouTube videos. I've always tried to show this in class because I do have a couple of videos I like to pull of this sound, specifically the seal bark cough as well. But the sound never quite works well over Zoom. So I've kind of stopped doing that. I would recommend you guys take a minute tonight and kind of go on YouTube and look up these different sounds. There's a lot of different videos out there of the whooping cough and the seal bark cough, so you can know and hear the difference. As well as, if you don't do that tonight, talk to your skills instructors. They should be able to pull up a video or something for you as well. Pneumonia. So pneumonia, fever signs and symptoms are going to be fever, chills, shortness of breath, rapid breathing, otherwise known as tachypnea, pleuritic chest pain, productive cough, etc. Typically, you'll need an X-ray to verify that they do, in fact, have pneumonia. So we do have a chest X-ray here. The lower lobes of the lungs, it should be nice and kind of black in this area, black meaning air on X-rays. And as you can see, there's quite a lot of white gunk that's kind of in here. Come around the side, this is the heart here. But so this patient was diagnosed with pneumonia. So pneumonia is spread by droplets, but does require close contact of several days. Treated with antibiotics. Prevention, there is actually a vaccine for this. I think anybody over the age of 65 or anybody at a high significant risk for pneumonia is recommended to get that vaccine. Good hand hygiene, good cough etiquette. Yeah. With us, if we have a patient that has pneumonia, we're going to assess lung sounds. Typically, they'll have very wet lung sounds in the lower lobes. We'll give oxygen. We can also give albuterol as well as CPAP for these patients too. Typically, it's not quite that bad yet. Usually, these patients are just very dehydrated, but we certainly can in those severe cases. Tuberculosis. So this is caused by a bacterium called Microbacterium tuberculosis. Signs and symptoms: cough, fever, night sweats, and weight loss. It's spread by coughing, singing, sneezing, and it's treated with antibiotics. Prevention, there's a vaccine for this. Keep a high index of suspicion if you've got a patient that's coughing quite a lot. The coughing will get so bad that it irritates the lining of the throat, and they'll start coughing up blood. With tuberculosis, I'm highlighting another thing. With tuberculosis, we always need to make sure we're using our N95 respirator. N95 respirator, tuberculosis, N95. Okay, that will come up. I can just about guarantee it will come up on the National Registry, and it will come up on one of your exams. Okay. Meningitis. So meningitis is the inflammation of the meninges that are caused by a specific bacterium. Signs and symptoms: fever, nausea, vomiting, headache, nuchal rigidity, so their neck gets very stiff, photophobia, so they're light sensitive, and possible petechiae. Petechiae is a super small rash. It's almost like somebody just got stuck with a needle a whole bunch of times. Like they just got scratched with a tattoo needle over and over and over with no ink in it. It's a very small pinpoint rash here. Spread by direct contact, treatment with antibiotics, and then there is a vaccination for this as well. STDs or STIs, these are viral STIs, or HIV, hepatitis, general herpes, and HPV. And then bacterial STIs would be chlamydia, gonorrhea, and syphilis. Prevention: condoms. There are a couple of vaccinations that can help with these as well. STIs are not something that we deal with a lot in EMS. If we are dealing with it, it's a high likelihood that it's probably related to pelvic inflammatory disease or PID in women. But most of the time, we're not dealing with these. Typically, patients will go to clinics. They won't call the 911. Not to say you wouldn't ever come across one, but that's usually not the case. Diseases carried by ticks. So this is something that is very prevalent in our area. Tick bites that have Lyme disease. Most patients will display a rash within a week that looks like a bullseye. However, Lyme disease is one of those things where it can take years for it to actually show itself in somebody's body. It is treated with antibiotics. Prevention would be, when you're in backcountry or wooded areas, making sure that arms and legs are covered. If you've got long hair, trying to wrap it up under a hat can be helpful. When you remove a tick, you want to make sure that you're getting out the whole tick. Now, I'm sure you guys are aware of all of the different ways that you could potentially remove a tick. The standard medical way to remove a tick is with tweezers. You would grab as close to the head as possible and pull straight back. Reason being, if you try and light it on fire while it's still attached, you got potential burns on the patient. We don't like that. If you try and smother it, which is another common method, usually with Vaseline, or I've heard some people use peanut butter. The idea being is that the tick will back itself out. It's not always the case. Sometimes it will burrow deeper. So the recommended medical way to remove them is with tweezers. Okay. There's always emerging and newly recognized infectious diseases. In some cases, antibiotics that used to be effective no longer work. They kind of create these super viruses. So there's always kind of different new things happening and popping up, right? Big thing is just make sure that you're using your standard precautions to help protect yourself, your coworkers, and your other patients. Here we've got a list. This is, I think, 2021 was the last time this slide was updated. It's the most recent up-to-date version of this particular textbook, but these are all of the ones listed here. COVID, obviously, being a big one that was new, recent. But also, there's always new things happening. It seems like each year there's new things happening. When the next outbreak occurs, remain calm. Understand that news reports may be exaggerated. And that's not getting political here. I'm just stating facts across the board. It doesn't matter which news you're listening to. They have a tendency to exaggerate. And then follow the recommendations of the CDC and your local health department. I think if there's anything that we learned from the COVID outbreaks in 2020 is that our system is not made for long-term outbreak to happen. It's just realistically we can't, right? We can't always be prepared to handle thousands of patients at a time. It's just not cost effective. So just remain calm. Stop buying out all the toilet paper, for God's sakes. That was a nightmare. All right. That was the end of this chapter. So I'll go ahead and stop the recording here.